special family, and welcome back to another video. If you're new here, hello, I'm Autism Mom, and on this channel we talk about autism and everything in between. If you'd like to be part of this family, click the subscribe button and the notification bell. So you will often hear that people with autism are described as low functioning or high functioning autism. Well, today's topic is high functioning autism. So high functioning autism was previously referred to as Asperger's syndrome. It is very important for people to know that there is not an official diagnosis of high functioning autism. There is an umbrella term or an umbrella diagnosis, and we all know it as Autism Spectrum Disorder, ASD. Autism Spectrum Disorder has certain criteria that you have to fit into to fall under that umbrella. So, but under this umbrella, people can fall on different ranges. They can fall from very severe to very mild. And this brings the confusion with the term autism and what it means. So here are some symptoms that someone with high functioning autism might have. If you see it, you can recognize it, and then you know, okay, they might have high functioning autism. So an individual with high functioning autism may be able to function fairly well in society. They can make their own food, they can take care of their personal hygiene, they can dress themselves, and they can even hold down a job. The basic life skills are not an issue for them. They can handle it. People with high functioning autism have difficulties with interacting with others. Social interaction and communication is not one of their strong points. And because of that, people then start to call them odd, weird, geek. You know how people are, they don't have any mercy. So the way these people speak or behave is very different than your norm. So that can give you an indication too, like, okay, something might be off. Communication and interaction with others is a major problem for them. They have difficulty with making eye contact or being social, or sometimes understanding others, their perspective or where they're coming from. It's difficult for them to make that connection with someone else. I don't know if you've seen the series The Good Doctor, but it is one of my favorite series, and up to this day it makes me cry. I can rewatch the episodes. But in The Good Doctor, the lead role has autism, and he's a doctor. He's very brilliant and very good at what he does. But if you're dying, or you do not have long to live, or you have some type of ailment that's gonna take you and he couldn't find a way to save you, he's gonna just plain come out and tell you, you have such and such cancer stage 4 and you have 60 days to live and you'll die, and not even flinch or blink, just like that. And he's not saying that because he hates you, he doesn't have empathy, or he's just cruel. He just can't relate. I don't know if he doesn't know how to read cues or understand how others might feel or think when they hear something like that. He just says what's on his mind, and he really thinks he's just being honest, because the honesty is a big thing. But they can't relate to, they can't put themselves in your shoes. That's what I'm trying to say. So that's a good series for me to refer to, because I can't think of anything else. But that's how someone with high functioning autism is. There is no such thing as personal boundaries when it comes to someone with high functioning autism. They might be loud when it's not necessary. They might be up in your space. They don't know what it means to have personal boundaries. And if someone is not familiar with it, they might distance themselves from that person, or they might interact differently with that person than they would with someone that does not have autism. So there are some of the skills that make a big difference with somebody that's struggling with autism and someone that's normal. And those examples that I just gave, the personal boundaries and the interaction, are some of the skills that they have difficulty dealing with. So let's talk about behaviors. Some common behaviors that people with high functioning autism might have are difficulty to have small talk, difficulty to make eye contact, You know when you start a conversation and you're talking with someone and you being polite and nice, how are you, how was your day, the whole nines? Yeah, they don't have that. They can't do that. It's a whole task for them. Some other behaviors are routine. If they have a routine, they stick to that routine. It's like repetitive behavior. I think it calms them down. But when what people don't realize is that if they are interested in something, they are 100% committed to it. I'll give you an example. I used to work somewhere where someone with high functioning autism had a job. She was the person that stocks all the supply machines on every floor with supplies. She worked the 7 to 3 shift. She's never late. She never calls out sick. She never has missed an order. She prints everything out. She can tell you what every supply is, what it's used for, and don't try to go on discussion or debate that it's not used for that. You'll lose. She knows what she's talking about. They go deep. They want to know the ins and out of the thing that they're interested in. She is never short of a item. If you said she needs to put 10 there, she won't have 9. She'll put 10. And if she can't find 10, she'll come at you until you find that 10 to give her so she can start. Because if she don't have all the numbers, if they don't match what she's supposed to have, she's not moving. So and it's fascinating to see how their mind works. Like if they're into something, they're in it 100%. And one time I asked her, what is this used for? She'll stand there and explain it to you high and low, the ins and out, and tell you exactly what it's used for. But in that time, she'll not make eye contact, not once. She'll be looking at the machine and talking to you, but she won't look at you. But she will tell you every detail that's necessary for you to know. So that's one thing that I was very, very impressed with when I saw how she handled herself with that. So I noticed the difference, that she doesn't make eye contact. She don't like small talk. If you ask a question, she gives direct answer. Now it's leave me alone, go get away from me. But it's fascinating to see. So people with autism can become super overwhelmed or shut down due to sensory overload. They don't like large crowd or excessive noise. Even at home, if I use the blender, I have to go to the balcony and blend stuff, or go in the bathroom with the door locked to blend stuff. If I pick up the vacuum, my child starts running. He closed the bedroom door and he go lock himself in the room. He knows all the appliances in the house that make noise. He doesn't want to be around that. But they're super sensitive to noise and crowds. Like it's like being in a club and it's overcrowded and there's this loud music pounding, people are stepping on you everywhere, and you're pushing them away to make room for you to be able to get out. That's the feeling that they're kind of having. Their senses are everywhere at that point, and their behavior they have behavior changes. They might seem aggressive and rude, but they're not aggressive and they're not rude. It's just they need to get out that environment right that minute because they're losing control. That's it. People like to think that individuals with autism have no empathy or they're not sensitive at all. That's not true. We must take into consideration that it's very difficult for someone with autism to be able to put themselves in your shoe or feel how you feel. Their brain is wired different. They can't make that connection. It has to be taught to them. And an example of that would be you think in color. Everything is simple. It's normal to explain. It's normal to have small talk. It's normal to make eye contact. It's normal to tap into someone when they're sad or they're going through something, they have pain. Your world is in color. Someone with autism's world is in black and white. That's the only example I can think of right now. Your world is in color, theirs is in black and white. So they don't know how to handle so you know that they care, but they do care. They just don't know how to show you that they care. I'll give you an example. I came home from work. I worked the overnight shift the whole weekend. I was super tired. Ramsey was having meltdowns all day, and I could not calm him down to save my life. And they just kept coming back to back. I was so exhausted to the point that I just broke down crying. I just stood there crying, and because I couldn't get him to stop having these meltdowns. And I'm crying. I'm super sad that I didn't even realize that he stopped having the meltdown, came over and sat next to me on the floor, and he was just looking at me. He's trying to read the expression on my face to see, like, he's trying to read what I'm feeling. But in that moment, I realized he feels that something's wrong. He knows that something's wrong. And him sitting on the floor next to me is the way he expressed that, I don't know what to do, but I'm here for you. I feel with you, but I just don't know what to do. Even though he was going through his own thing, he stopped his sensory issue to deal with my emotion in his own way. So that's the only example I have right now that I can think of. This video was made to give a glimpse of how someone with high functioning autism might present themselves in the world. I just wanted to share a few points so you can have a better understanding of what some of the difficulties are that they might have or live with because of autism. We have to realize as a society that people with autism brains are wired differently than ours. They don't fit into that perfect world box that is normal to us. And they don't speak the same language as us, but they're here. And as a people, the sooner we accept them, the less we look at them differently, because autism is only a diagnosis. It's not who they are. Thank you for watching my video, and I'll see you in the next one. Bye.